You have to have reliable equipment, and you have to really know your broadband width, whether you can run 1 or 2 conferences at the same time. In some of our centres we tried 2 and it doesn't work.
The upskilling for telehealth for our nurses is mainly around the technology. Okay? They understand the clinical skills well.
So when we're looking at this technology, we need to see how it can become naturally part of the way in which people work in their work environment. And so it's very important that the technology doesn't become between people, but the technology actually brings people closer together. So the nurse, the doctor, the specialist, we need to create a team that is actually bonded together by this technology and make sure that the technology doesn't divide us. So when you think about the technologies that have really exploded, the fax machine is a very good example. What did we have to learn to use a fax machine? We already had a telephone. We already knew how to photocopy a piece of paper. We took those 2 skills, combined them together, and we knew how to send a fax. And the fax gave us a magnificent benefit because I could send a page of text to London in about 6 seconds.
It's got to be cost effective and it's got to be convenient. When we're looking at our rural patients and remote patients, it's really got to be something that they can access and something that is ongoing and realistic for them. So I think telehealth provides all of that. Because they can have regular reviews, ongoing monitoring of their care, and support.
So you need to make sure you're using services that in fact provide the assurance of privacy and the assurance of security so that private health details are not broadcast out onto the internet. And the professional services today in video conferencing, in the way in which they're implemented, do protect privacy and security. What we've got to do is to actually think about the patient and make their journey through use of the technology more enjoyable, more engaging, more efficient, faster, cheaper. And we need to look at the healthcare professional and say, how can we make their participation in the healthcare interaction faster, better, more engaging for them?